start this Facebook session now, Doctor?
Yeah, sure.
Hi everyone, I am Bella. Happy Saturday. Thank you for joining our Facebook live session today on a Saturday afternoon. And with me today is Dr. James Fogg, our ENT Specialist, and we would like to talk about ENT daycare procedures. What should you know? Okay, basically, we're going to have a quick chit-chat session, Doctor.
Sure.
Just to let our audience know what are the procedures can be done, what is ENT, and what do people should know about daycare procedures at Sunway Specialist Centre Damansara. Okay, Doctor. Before we start, can you explain a little bit what is ENT and what does an ENT specialist do?
Oh, okay. Hi, good afternoon. I'm Dr. James Fogg, the ENT Specialist. So, an ENT Specialist is basically a qualified medical doctor or medical specialist. So, we deal with a lot of common ear, nose, and throat problems, and also problems in the head and neck region. So our cases can be simple, such as ear block, allergy in the nose, hearing loss, for example, difficulty swallowing, problems with sleeping, and it can be very complex as well, such as head and neck cancers, skull-based surgeries, implants, hearing implants, things like that. So at the same time, we are also surgeons, like I mentioned earlier. We do a lot of surgeries that involves the head and neck region. So we deal with a lot of ear, nose, throat, head and neck problems. Also, we forgot to mention, we also deal with other problems such as dizziness, and some of us do with plastic surgery, such as nose jobs and so on.
That involves you guys, the ENT surgeons.
Yes, some ENT specialists.
Okay. So you can screen and also you can perform surgery, right?
Yes, correct.
Okay, I think the word daycare surgery, can you explain more what is daycare surgery compared to hospitalization?
Okay, so daycare surgery is a relatively new concept. I mean, I think it's only popularized back in the late 80s. So it involves surgeries that can be done in a day. So what happens is a patient who needs surgery will be admitted to the daycare center. The surgery will be done, and the patient can be discharged home on the same day after the surgery.
So meaning they can go back on the same day they have the surgery, right, Doctor?
Yes, without needing to admit in the ward, like traditional way of surgery previously.
We all know that Sunway Specialist Centre Damansara, besides providing specialist consultation, we are a daycare surgery, correct? Okay, can you tell us what types of ENT surgeries can be done here at Sunway Specialist Centre Damansara?
Okay, so Sunway Specialist Centre Damansara it's actually built and designed to be a daycare center. Right?
Yeah.
So we have the facilities for to function as a daycare surgery. We have an admission ward. We have the OT, the operation theater, and also we have a recovery bay. So after the surgery, the patient can recover in this recovery room, and once they are fit to discharge, they can go home. So in terms of ENT surgery, I would say most ENT surgeries can be done as a daycare procedure. Well, I would say most ENT cases should be done as a daycare procedure unless otherwise.
It's more complex.
Yes, unless when it comes to more complex surgeries that I mentioned earlier, head and neck, cancer surgeries, skull-based surgeries, those complex surgeries then will need admission to the hospital. But generally, simple routine I would say simple procedures such as no surgeries, like surgeries to unclog your sinuses, like functional endoscopic surgery, surgery to straighten the septum, such as septoplasty, to reduce the size of the turbinates, inferior turbinoplasties, like surgery that we do in children, such as removal of tonsils, removal of adenoids, ventilation tube that we put through the eardrum for blue ear. We do a lot of minor procedures such as removing lumps and bumps from the neck and so on. Yeah.
So I can say that the concept is the same as what we can have at the hospital. Is just that they can go home and see it.
Yes, yeah. That's a big advantage for the patient.
Okay, alright, doctor. What types of patients are suitable for daycare surgeries?
I would say most patients are suitable for daycare surgery, but of course there are criteria and protocols that each center, different centers have. And in SS, Sunway Specialist Centre Damansara, we have our own guidelines and protocols as well. So in generally, we would classify into patients that are fit for surgery, meaning patients who do not have any underlying medical conditions, or they have medical conditions that are well controlled, meaning, for example, diabetes that are well controlled, hypertension that are well controlled with medications, or asthma that are well controlled, for example.
Okay, so no risk if you are well controlled or you have no medical conditions underlying, then you can complete and you can have your daycare procedures here.
So in terms of the procedures, surgeries per se, those surgeries that are short, for example, surgeries that can be done within 1 or 2 hours, and also we don't expect complications from these cases, such as extensive bleeding. Most of these patients can recover very well after the surgeries with minimum pain, minimum bleeding. These are good cases that can be done as daycare surgeries.
As you mentioned just now,
surgeries.
As you mentioned just now, right, doctor, we have the OT, we have the recovery bay. So the center is quite comprehensive to take all types of daycare procedures that needs to be done here.
Yes.
Okay, alright. Other than that, what are the benefits of daycare surgery?
So the benefits of daycare surgery is especially beneficial to the patients themselves. So, for example, number one would be that because the patients can go home on the same day, they can recover in a familiar home environment. So they can recover at home, which they are familiar with. And so it's less stressful for the patient.
More comfortable for them.
Definitely more comfortable. I mean, nobody likes to stay in the hospital for a long time. And also, it's sorry, I'm just let me see.
How about the cost, doctor? Is it more affordable?
So definitely more affordable. So there is no cost of accommodation. So there's a lot of cost reduction. So it's meant to be cheaper for the patients, more affordable for the patients. Yeah. So patients, because they can go home early, they can recover faster, and they can go back to their routine activity faster. They can go back to work. They can go back to their families. They can do normal things that they do at home. So yeah, it's
That's
good.
those are benefits.
Less disruption to their life.
So, but in case of anything, they can still come back and see the doctors here, right?
Yes.
Anything happens after they go back to home, to their house. Okay.
So I forgot to mention that another criteria for patients to be able to do under daycare surgery is they are able to have a adult supervisor or adult carer at home. So this is, as you mentioned, in case if there is an emergency, they can have transport to go to a nearby hospital for treatment. And also, it's important to have a phone. I think nowadays everybody has a phone.
Yes.
So we can, if there's an emergency, we can call an ambulance to pick them up. And also, it's important that their house is not too far away from the hospital. So if their house is within half an hour from the hospital, that would be ideal.
But if less complex, then they can wait to see the doctors during the business hours of consultation.
Yes.
Sorry. What do we say that? During the operation clinic.
Yes.
If it's less complex, if you can wait.
Yes. So usually we will, after the surgery, we'll give an appointment for them to come back and see us for post-op treatment.
Doctor, can you explain to our audience that how can they schedule for a daycare surgery here and what can they expect?
Before we schedule a patient for surgery, we would like to see the patient first, of course. So the patient can either come as a walk-in patient to see one of the ENT doctors here, or they can schedule an appointment in the clinic. So when they come and see us in the clinic, we will go through the history again, we will examine the patient. And then if you think that this patient does need surgery, we will go through the whole procedure with this patient. And also we'll try to answer any questions or doubts that they have. And then we'll explain the whole procedure before, during, and after. And then we will also refer to the anesthesiologist for a pre-op assessment. So the anesthesiologist, the doctor, the specialist who will give the anesthesia to make you sleep during your surgery will determine whether you are fit for a daycare surgery. So once he or she determines that your surgery can be done as a daycare procedure, we will schedule you for appointment for a date for surgery here, and then we will give you some leaflet or information on what to do before, how to prepare for surgery before, and what to do after the surgery.
So when they come into the clinic, right, doctor, you have all of the machines, right, to do the screening, to see what's happening before they proceed with any surgery, if it's needed.
Yes, we have a very comprehensive, well-equipped ENT clinic with all the equipment that is needed to make a good diagnosis of their problem.
So basically, the daycare concept, it's in and out. It's faster, the turnaround time is faster, you can go back home right after the surgery. I mean, you have to rest first at the recovery day, doctor. And cost is another thing that they can save.
So usually after the surgery, we would keep the patients for a few hours. Once the patients is not fully alert, they do not have any more nausea or vomiting, and they are able to walk unassisted, and they have no issues, and we can go home. Usually, I would say an average, maybe 3-4 hours or so.
What is the maximum hours they can do rest here?
So our daycare here starts at about 8 o'clock. We also run our daycare until about 9 at night. So it depends on when the surgery is done. If it's done in the morning, they can actually, if needed, they can stay here up until our closing hours. If in rare circumstances that the doctor do not think the patient is fit for surgery, then we can always transfer the patient to another to one of our other Sunway hospitals for admission,
Yes.
and then the doctor can go there.
Okay, alright, doctor. I think that's a wrap up for
Okay.
our chit chat session today on what is daycare surgery and what are the ENT procedures that can be done here at Sunway Specialist Centre Damansara. Before I open the live session for questions, I would like to announce that today we are going to have a flash sale for our ENT screening worth of RM200. Don't miss this chance. Grab those days, as we only offer this price until 6 p.m. Okay. Alright. I think before do we have questions already? Oh. Okay, doctor. As a live session, right? We can see the comments. People drop their questions already here. Okay, doctor, can we go through the questions? I will read out and we can let.
I'll try to answer.
Okay, it's from Shinate. She asks, how soon can I go home after post FESS surgery? I think this is an
okay.
surgery.
So FESS surgery is a sinus surgery when we open up the sinuses.
Yes.
I would say it also depends, because FESS can be a very simple FESS surgery, can be a more complex FESS surgery. But most of the time, if you do an FESS surgery in Daycare, it usually would be relatively simple. So I would say, post-op, I would say around 3-4 hours after that. So our main concern for FESS surgery would be bleeding after surgery. So, if we monitor the patient sometimes up to 6 hours, if there's no bleeding, usually it's less likely to have problems bleeding thereafter. So, yes.
And we can go home on the same day.
Yes, yeah.
I hope doctor answered your questions. Ms. Sheena? Okay, the next question is Chung Yong. Is it safe to proceed with my child's daycare procedure during this pandemic? I think this is one of the concerns of a mother here.
Okay, so for children for daycare surgery, we have some criteria as well. Usually children above 6 months of age can be done here. So in terms of, to answer her question, your question is, we are a daycare center, so we do not have any admitting patients, we do not have wards. So you can be assured that we do not have any COVID positive patients in our center, and we do screen our staff, our patients.
Even the patients, right? Doctor?
Yeah, so we do follow very strict SOPs. Every patient that comes in, every staff that comes into the clinic, we have to, do the My Sejahtera scan, check the temperature, have to get a brief history whether they are, at risk of any contact recently of COVID and things like that. So I would say it's safer
At the daycare center.
Yes.
Okay, doctor, tell us a little bit, what are the protocols here at Sunway Specialist Centre Damansara during this pandemic? What are the actions taken to ensure the safety of everyone?
Okay, so like I mentioned just now, we follow very strict SOPs. So everybody, as you can see, we have to wear our masks, keep social distance. We have to scan before we come in. We have to check our temperatures. If our staff are unwell, if they have fever, if there are any signs of possible COVID infection, we are not given leave. I would say, not encouraged to come to work. We sanitize all our equipment, chairs, furniture regularly.
Yeah. Even for the things in the OT, right, doctor?
Of course, yes. OT equipment it's always sterilized, and we always ensure the highest safety and hygiene standards in our center.
Alright, okay. Next question, doctor, is from Hazira. Is it possible to do tonsillectomy or adenoid tonsillectomy under daycare?
Yes, in fact, most of the time I do tonsils and adenoids under daycare nowadays. I like to use certain instruments. Nowadays we have modern instruments that have much less bleeding than traditional instruments. So traditionally we use a lot of what we call cold instruments like knives, scissors, things like that. That tends to cause more bleeding. But nowadays we have technology such as the harmonic scalpels, the cold platers, still very minimum bleeding, I would say. Yeah.
Okay.
So it is safe to be done.
Hope that answers your question, Ms. Hazira. Okay, the next question is that Yvonne Lee is asking, are there any treatment for hearing loss besides hearing aid?
Hearing loss, I would say it depends on the cause of the hearing loss. So hearing loss can be divided into what conductive, so something that is blocking sound from entering into your ear. For example, an infection, earwax, things like that. And those kind of those causes can be treated. However, if I think what you are what's in your mind is more to what we will call a sensory neural hearing loss. So this hearing involves the nerve. So there's a problem where the sound has, when we hear sound, it cannot change into a stimulus that our brain can interpret as sound. So a sensory neural hearing loss, unfortunately, there is no treatment. So hearing aid is the best treatment, and I would also put a note that the best treatment for hearing loss is still prevention. So yeah,
so they should see the doctor if they have a little bit of symptoms of not hearing well.
Yes, so if we catch it early, we can advise the patient on certain things that they can do to protect their hearing from deteriorating further. We see a lot of these people who work in a noisy environment. Their profession involves encountered with very loud sounds such as machineries, things like that.
So they should have the annual screening, right, Doctor? For the hearing.
Yeah, it is mandatory for screening in our country if they work in environment that has of certain loudness environment. Yeah.
Okay. Alright, the next question is that from Shamli. My nose is easily irritated, especially in the mornings. Should there be cause for concern? Thank you.
So a lot of people have this problem. They have a bit of nasal, what we call nose irritation. Some people have runny nose, sneezing, especially in the morning. Usually I would encourage you to see an ENT so that we can actually just take a look, get a history, take a look inside the nose. Most of the time it's just something as simple as just allergic rhinitis, which can be easily treated with medications such as nasal spray or even simpler methods such as just using salt water irrigation of the nose and things like that. But anything that concerns someone, or I would always say, don't wait. Just come and see a doctor if you're worried. Yeah.
Yes. Okay. All right. The next question is that, doctor, is it normal to experience blocked nose whenever I lie down?
Oh yes. Well, most of the time it's physiological. So what happens when we lie down? Our nose does get more congested than when we are, say, upright. But most people, they don't have this. They don't feel it. Everybody has it, but most people don't feel it. You get what I mean?
Yes.
So if you feel it, if you are aware of this congestion, usually there is some underlying cause. So it may be an allergic rhinitis or sometimes non-allergic rhinitis, for example. So the nose, the inside of your nose is like more swollen than usual. So now when you lie down, you are more aware of
The
your
feelings,
nose
right?
block.
Yeah.
Yeah.
So they have to come and see the doctor.
Oh yes, I mean to a lot of things that coming back to your first question,
Yes.
what does an ENT doctor do? I would say most of the time we deal a lot with quality of life issues.
Quality of life issues.
Yeah, so unlike other doctors, some doctors they deal with life and death. It's like for example, neurosurgeon. If you have a brain tumor, you have a stroke, you have a bleeding in the brain, you will see a neurosurgeon. But for ENT, usually it's more like quality of life. For example, if your nose gets a bit blocked, you come see an ENT.
Yes.
You can't hear so well, come see an ENT. Something bothering or swallowing, you come and see the ENT.
Yeah, but if they leave it there, then it can be dangerous in the future. Right? It can be harmful.
Yeah, because sometimes harmful conditions can present early as something that is very common. Yeah. For example, just give an example, like nasopharyngeal cancer can present with this reduced hearing or ear fullness or ear discomfort. That is usually the first symptom. So it can be something very, mundane or nothing significant.
Yeah, I don't think this is normal, then I just leave there. Okay.
So I would say anything that is not normal or you feel something new, and if it's not getting better after say 1 or 2 weeks, I would say come and come and check. Yeah.
You have your screening done, so that the doctor can diagnose you and advise you as the next step.
Yes.
So I think our time is up. Alright. If you have any further questions, don't worry, you guys can still leave your question in the comments box or messages, and then we will reply you individually. Okay, doctor. I think our time today is up. Thank you, Dr. Once again, Dr. James Scott, for your time. You're on a Saturday. I'm sure the afternoon is going to be busy with your clinic. So there you go. Don't forget about our flash sale, and if you have any concern, you can still call us, and we will try our best to advise you. And if you have any worries, make an appointment to see our ENT specialist. Okay. Alright. Thank you. Bye. Happy Saturday.